So I don't think I sent you all an official title, so here it is, System Science at NIH. We're going to cover programmatic interests, funding opportunities, and resources. This first talk will be by me, but I'll be joined by colleagues. When Ling originally invited me to do this, we thought that I would give you all a talk, which I was happy to do. But then the more I thought about it, and she told me that she would like to have folks have the opportunity to ask questions about their own specific research applications, especially NIH applications, we thought it would be a great idea to bring in other people. So we have with us a bunch of other folks who will be joining us for a Q&A session following this first talk by me. So this talk, think of as an overview about what's been done at NIH. That's kind of what I understood that Ling would like me to talk about, as well as provide a variety of resources for you. I gave a similar talk to this one just for any of you who may have attended at the Network on Inequality, Complexity, and Health, which was a meeting held on February 24th and 25th last week. So it's not too much updated from that, but that one wasn't recorded. So this one is being recorded for the general public. Okay, let's start. For some reason, the slide is not moving when I hit my keyboard. Okay, so introduction. Am I hitting the wrong key? There we go. Okay, now I have the correct key. Thank you. So first, I think it's helpful for everyone to know a little bit about our office and what we do and why we might have engaged in system science in the first place. So our office is part of the NIH. As I mentioned to you, there's others here from NIH joining us. They are from what we call the ICs, the Institutes and Centers. The question I always get is, which institute or center are you in? And the answer is we're really in the Office of the Director, which works across all the 27 institutes and centers that make up NIH. The goal of our office is to stimulate behavioral and social science across these 27 institutes and centers. Our Office of the Director within that has a division of program coordination, planning, and strategic initiatives, and that's where our office sits, as well as Office of AIDS Research, Office of Disease Prevention, Office of Research on Women's Health. Our budget is about 25 to 28 million, depending on what year you're looking at. And it fluctuates, of course, with cuts from Congress and stimulus funding and things like that. The overall budget is about $30 billion for all of NIH. So we're a very small fraction of that. But that doesn't mean we're not important. We develop funding initiatives, we provide training and career development for behavioral and social scientists, and importantly, we convene workshops, conferences, and lectures such as this one to help stimulate the use of, in this case, system science methods, but more broadly to stimulate topics of interest to are relevant to the field of behavioral and social science. So this one didn't show up. Oh, this is the problem that was talked about. So for some reason this slide is not showing up, but it talks about the strategic priorities for the office. And I'm going to do a disservice by misremembering the exact content of the slide. But when we give you these will be made available, and we'll make sure that this slide shows up. But among our priorities are training and methods, innovative methods, including system science, including other areas too, like mobile health, which we'll talk about, big data, we're going to talk about that a little bit, D&I, which is dissemination and implementation research, and multiple chronic conditions, shared decision making, meaning provider and patient decision making. I'm going by memory, so there are a variety of others. Basic behavioral and social science research, which has been championed by out of our office by something called OPNET, the Basic Behavioral and Social Science Opportunities Network. But for today, we're going to focus really on this thing called system science. So I think it's important for you to understand what it is and why we care about it. So first of all, definition, system science is a family of methodologies, research methodologies, that enable the study of complex problems. So in other words, problems that have certain aspects to them, like feedback loops. Those are bidirectional relationships, and a variety of other complexities to them. These methods enable the complexities of a problem to be represented in a tractable form, and to allow you to explore it without dealing with all of the complexity, but just enough of the complexity that you can get a better understanding of the real problem. So I think this is kind of a key piece, so I'm going to stop and take a minute to really explain this part. So all models are simplifications of reality, and they're simplifications because the reality itself is too complex for us to deal with. So the whole goal of modeling is to make the complexity of reality more simple in a model, but it has to be complex enough that it captures enough of the real problem that it makes it worthwhile for the study. Hopefully that helps clarify that a little bit. These methods address the big picture of a complex problem as well as the components that make up the system. So it's important also to note that these complement other methods. So I've never been advocating to replace the use of traditional methods in behavioral and social science with system science methods. Rather, I think the system science methods, these methods that deal with complexity, have been underutilized, and I'd like to see them used more. Modeling and simulation, or mathematical and computation modeling and simulation, characterize much, if not most, of system science methods. The reason that we've been investing in these methods is that we recognize that the types of problems that we deal with in behavioral and social science as they relate to health are really complex. So you can appreciate, once you start to look at the behavioral aspects, that there are many of them and they're interrelated and they play out over time, which makes for a complex picture. For example, a person's genetic makeup may influence their health risk, but it might interact with their behavior, such as smoking, but it also might interact with other behaviors, such as drinking alcohol, other behaviors, such as decision on to whether or not to get screened for a specific disease, or how much they exercise and what they eat. And all these things can change over time. Somebody might eat a healthy diet for a period of time and change and eat junk food on the weekend. So these are all complexities that we need to deal with in investigating behavioral and social science aspects of health problems. So we need, because of these complexities, we need complex methods to match, which is what system science provides. I had previously had this slide as BSSR investigators are not aware of these methods, but this has changed over the years, I'm happy to say, and hopefully at least in part because of some of my and others who are here at the table today, their efforts. So people are becoming aware of the methods, and investigators are now greatly seeking training. We had 800 people register for our meeting on last week, the Network on Inequality, Complexity, and Health. And of those, some 80% indicated in the registration form that one of their key top interests was training. We have provided a lot of that out of our office, and we'll talk about that in a little bit. Hopefully, some of the resources in this talk today will help address some of the training needs. We do want to aid the investigators in using the system science method. So when I talk about the complexity, here's sort of a graphic that we use. The outside the skin levels, the under the skin levels, and how they interplay with each other over time, over the lifespan, and over generations, in fact, at multiple time scales. So there can be time scales of things like cell division, and there can be time scales of intergenerational transmission of a health disparity, for example. So this is just a nice graphic that was adapted from Glass and McAtee that we use in our office to convey this concept. System science methods specifically, I mentioned there are an array of methods. They include agent-based modeling, microsimulation, system dynamics modeling, network analysis, discrete event simulation, Markov modeling, a lot of operations, research, and engineering methods. But this is not an exhaustive list. There are certainly others that are not mentioned, not because they're not important. We in our office tend to have really promoted agent-based modeling, system dynamics modeling, and network analysis, mostly because those were the three that were ready and most applicable at the time we started, but not to discount any of the other methods. They're all important, and all of them fit under our funding announcements. These methods are designed to capture dynamic behavior, that is, change over time. I mentioned previously feedback loops where A affects B and then B turns around and affects A. It could also be variable A affects B, which affects C, which turns around and affects A. So there's those kind of complexities. Nonlinear relationships where you see, for example, threshold behavior. Everything goes along fine until it hits some sort of tipping point. Or there's also worse before betters scenarios. That is, if you intervene in a system, you discover that actually things get better at first, and if you just stop evaluating at that time, you might decide to abandon the strategy when actually in the long run that strategy will work. It's just that things have to get worse before they can get better. And time delayed effects. They help you detect unintended consequences. We've all, I think, are familiar with these terms where you do something you think will make things better and it in turn either makes things worse or it doesn't help, or things are detracted. Maybe the effect is diluted in some way. They can help us identify emergent properties. That is, if you broke down a problem and only studied the individual pieces, you might miss the aggregate of those pieces when they're all combined together in a system. And if you study the system, you can see some of those things without things that might not actually be attributable to any single component of the system. And they can also help us not only identify what our gaps are in knowledge, but tell us how important those are. By using sensitivity analysis, we can identify which pieces of information that we're missing are the most important to get to the better understanding of the goal we're after. A lot of modeling and simulation is about in silico virtual experimentation. That is, you create a virtual world that resides on the computer and you experiment in that world, which isn't the same, of course, as the real world. Anybody who knows SimCity or any of those kind of things knows that it isn't the same, but it might be able to provide us important insights that we miss in the real world because of the real world's complexity. It also affords us the ability to do testing, much as you might in an in vitro lab. The biologist might do an in vitro. We might do in these what we're calling in silico or computer labs. And you can see some examples of that in a few minutes. And I guess also very important is kind of at the bottom of the slide that you can't read. I'll fix that on the slides we send out. But these methods are useful for generating hypotheses that can be then later tested with an empirical method. This might be really important for honing down which studies ought to really be conducted. This is another slide that says much of the same thing, but talks about capturing temporal properties, spatial properties, network structures, hierarchical and nested structures, feedback loops, individual and group variation, mediating and moderating variables, and nonlinear and non-parametric properties of the system. Just a different way to say many of the same things. I mentioned some of these specific methods, but some of the related terms we use at NIH include complexity science, complex adaptive systems, nonlinear dynamics. When you hear those things, the bells should go off in your head. Oh, they're talking about something that's related to system science. So I just wanted to put that down for you. So to give you a little bit of historical perspective on all of this, most of this is going to be coming from my very own perspective coming here to the NIH. I'm trained as a clinical psychologist. I'm not formally trained in system science. I became familiar with it when I was a contractor at the National Cancer Institute in the early 2000s. I moved over to the Office of Behavioral and Social Sciences Research, OBSSR, in 2005, late 2005, and sort of really began applying myself and developing a program of system science in late 2006, early 2007. So what kind of led me to that point and led our office to that point? At that time we were directed by, our director was David Abrams, and he saw a future for system science, and he very bravely put that into my hands to shepherd forward. And what kind of had been influencing our thinking was the CISNet, which is the Cancer Intervention and Surveillance Modeling Network at NCI. I'm sort of cataloging them all here for you so that you can go back and look them up. But there's a MIDAS study that was also going on. These are in the early 2000s. These are both still going on, by the way. Models of Infectious Disease Agent Study out of NIGMS, the Interagency Modeling and Analysis Group, led by Grace Ping at NIBIB. There was also, as I mentioned, at NCI, something I had a small part in, which is the Initiative on the Study and Implementation of Systems, which is mostly systems thinking. There was a prevention impact simulation model being developed at CDC, which I was fortunate enough to get involved in, and I'm going to be talking about that in a little bit more detail later. And this is important if you want to go back and read. March 2006, there was a special issue of the American Journal of Public Health devoted to systems thinking, and I think that's worth going back to. I can't recall if the University of Michigan Complex Systems Conference was video recorded, but I do have other video recordings I will point you to. Also going on around this time was, got a big splash, was all over the news and the press. Christakis and Fowler had a network analysis that was published in the New England Journal of Medicine on the spread of obesity across social networks. They later came out with similar studies from Framingham data on tobacco, happiness, cooperative behavior. And Nicholas Christakis got named in 2009 one of the 100 most influential people by Time magazine. So this is kind of all getting a lot of attention and buzz when we sort of decided to get involved. So in my office, we became aware that, I should say one of the first things I did was become associated closely with Bobby Milstein, who was at the time at the Centers for Disease Control and Prevention, CDC. And he helped me quite a bit in terms of grounding me. He had been taking some formal doctoral level coursework in system science and was able to point me to the right resources for me to learn about it. And we very quickly, between the two of us, figured out that we both had very similar goals in terms of elevating the profile of system science and getting it adopted more broadly among behavioral and social science researchers. And we also realized that people really were unfamiliar with what it was. So we developed a symposia series on system science and health. It was designed to be really an introduction, a primer. And we have that video cast, and it's still available today. And it comes with a subscription to my listserv, which I'll talk about later. We also developed this listserv, which you can become a member of, which was our way of figuring out how to communicate with people who were newly interested in system science and trying to help speed the growth of the field. So it's still just me posting once a week to the listserv, and I post relevant items on job opportunities, conferences, training opportunities, articles of interest, a lot of things that people are interested in, conferences. And you can subscribe for free if you would like, and I'm going to be continuing to run this listserv. You can also, if you wish, send me anything that's relevant. People often send faculty position openings that relate to system science, or send me an article that they've co-authored or heard about or found useful. We also created opportunities for cross-fertilization. So, the training we developed was a week-long training called Institute on System Science and Health. We were able to do it for 4 years. We're not able to do it anymore, at least in the same way. Also conferences to help people. These were ways for people to meet experts in system science, people who had content area expertise to pair with system scientists. And I still believe this is really a very good model. So if you're at all interested, I think you should try to find, if you're a person who has the content area background, I strongly recommend you try to find somebody who's got the system science background. And the ways to do that are to go to conferences. So SBP is Social Computing, Behavioral, Cultural Modeling, and Prediction. I have another slide later that talks about the one that's coming up in 2014. It's in a few weeks. We've also developed funding opportunities. So we tried to help people be able to apply once they got interested in system science. How are they going to apply that to their research question? And the way that we wanted to help them was to get funding through these funding opportunities that are listed here. If you really want to know more about the history, you can see a recent article published in October 2013 by myself and our director, Dr. Robert Kaplan. It's in Health Education and Behavior. We also established something called Envision that's part of NCORE. So NCORE is the National Collaborative on Childhood Obesity Research. It's a collaborative between 4 funding agencies: NIH, CDC, U.S. Department of Agriculture, and Robert Wood Johnson Foundation. As part of that, there's something called Envision, which is a modeling network. We have about 11 teams developing statistical and computational models related to obesity. And I'll talk about some of the work that came out of Envision later, or right now, I guess. So this is the next slide. It's out of Envision. One of our investigators is David Shoham, and he published a paper in 2012, references at the bottom of the slide. And this study set out to determine whether social influence or homophily, that is, selection of friends who are similar, was responsible for the observation that similar weight people are clustered within social networks. They used agent-based modeling and network analysis in this study. I think it's really important, and I cited it just this morning in a meeting that I was in, as a way of disentangling selection as a compound, selection bias. So I think it's a useful read for you all. There's a couple of great articles also from Envision by Ross Hammond, and Ross, again, is one of our PIs in Envision. He's an agent-based modeler, and he's been working on a problem of obesity. This first paper is about reward learning, and he's done some wonderful talks on this. I think some of them are recorded, but it's all documented in the paper. And I would really encourage you, I believe, if I'm not mistaken, you can go and actually look at the supplemental material and see the movie. I don't have the movie, but it shows what he did was a grid demonstrating people's reward preferences. So he made agents that represented people in his model, his computational model, and he gave them real, based on real data, preferences for learning how much to prefer different foods, and he put them in a quote-unquote environment, which was really a grid, but to simplify the real-world environment of where you might go and see fast food joints with highly palatable but high caloric food versus healthy food, you might say the whole foods of the world. He simulated that on a grid and put high palatable and low palatable foods on the grid, and simulated in time, and showed that the history of people's exposure to foods, these different high and low palatable foods, and their reward learning style based on their, I guess, genetic makeup, led them to different responses as adults. So what he showed was that when you have a finding, which they do, that some people think that the food environment that people in has a lot to do with what their food preferences and what they eat ends up being as adults. But what usually that literature doesn't capture is what their exposures were during development as children. And what his model shows, at least, that it's possible, based on the data that he fed the model and the assumptions, that reason for not being able to find that association is that food environment is related to people's preferences, but not their current food environment. It's really more influenced by their prior environments. So I really strongly encourage you to read this paper. It's a fascinating paper. He's done another one looking at, just this year, I think, 2014, looking at social influence on body mass index. And if I have it, you'll see that he's going to end up doing 5 different modules. And those squares, the two at the top, the green and the red, demonstrate are grids that are showing the agent models, static pictures of those. But you see he's going to be incorporating into these models neurobiology, genes, environment, physiology, and social environment. And these are all remember, the complexities of the problem, and those arrows demonstrate there's interactions and feedback between a lot of these different elements. It's a wonderful study. I encourage you to read it. The lower left-hand square is a satellite picture of Montreal. He has wonderful data at the household level for where people reside in Montreal and their genetic makeup, as well as where all the fast foods are in the environment. So it's going to be a wonderful model when he's done with all 5 pieces. So I want to stop here to sort of, before I talk about more Envision work, to give you a little bit of background, because this is really important. This is a very underappreciated paper, or at least I've never seen anybody cite it except me. But it's Froelich and Potvin from American Journal of Public Health in 2008. And in this paper, they're talking about the need to pay attention to the distribution of a population when you try to improve population health. If you look at the distribution that's highly peaked, the higher peak, that's before the intervention. And then if you're just looking at the mean, and should you make a change in the population that reflects the second distribution, the one that's has the lower peak, you might conclude by looking at the means that you've made a big difference in the population, and indeed at the population level you have. The problem with this is that you may have actually accomplished this improvement in the mean by helping the people who didn't need the help. And so if you move the upper end of the distribution, the people who are most well off, people on the far left there, concentration of benefits, if you help them and move them over, of course you're going to move the whole distribution over, the mean, but you're going to leave behind those people who are the most disadvantaged. And so they talk about this paper being a real danger of leaving people behind when you try to intervene at the population level, unless you're sensitive and careful. So I sort of took that and realized that they talk about the inverse care law that states that those with the most resources adapt to new situations and will be the first to derive maximum benefits from population approach interventions. And so I've kind of taken that to say, gee, we really need to pay attention to the distribution in everything that we do, not just any particular topic. This one happens to be from the American Society of Nutrition, talking about variability in responses to diet and food, but take it as an example. In this particular case, they say that the top priority for future nutrition research is the need to better understand the variability and metabolic responses to diet and food. Okay, but fill in the blank. In metabolic responses to diet and food, or to physical activity, or to, psychological responses to an intervention, whatever messaging about cigarettes, whatever you want to put in that blank, we need to better understand the variability, and we need to look beyond the mean when we're looking at population level research, so that we don't widen our health disparities and trick ourselves into thinking we made a difference when we really have in some ways made things worse by creating a bigger gap between those who have and those who don't. So how could system science methods help with this kind of problem? So Kiros Berhane from USC has this method called Bayesian quantile regression and mediation analysis, in which he's able to look at the mediational effects of a variable on any point of the distribution, any quantile of the distribution, meaning at any point on the distribution. So it's a real helpful type of method for helping characterize the benefit of an intervention, on who's benefiting. And so in his particular study that he has, and I'm sorry to say I don't know of anything that's published yet. I know of one that's in manuscript in progress, and it's been held up by yours truly here. I'm a co-author on that one. But what it shows is that he had an intervention for a group of obese individuals, and that what actually happened in this case is that it was the opposite of this inverse care law. It actually helped the people with the most highest BMI the most. It was a environmental structural intervention to increase physical activity. There are other methods that could be used and brought to bear on disparities research, including I would suggest you look at Ip et al. References on the next slide, the dynamic chain Markov models that could really break down vulnerability as constructs that lie underneath what one might call as the obesity superstate. Ross, well, that's the last one, sorry. System dynamics models could be used to examine the effect of obesity policy on vulnerable subpopulations. I encourage you to look at work of Hajir Ramadad, who's one of our Envision members. Jack Homer and his group, there'll be more references under PRISM. They're not part of Envision, but they also have done system dynamic modeling. And I've already told you about Ross Hammond's work, so here are the references. I also want to mention the Johns Hopkins Global Center on Childhood Obesity. This was established in September of 2011. It's a cooperative agreement, meaning there's input from the NIH. It's a collaboration between the NIH scientists and the PIs at the institution. It's funded by NICHD and our office, OBSSR. Yufa Wang has the original PI, and he's subsequently moved to University of Buffalo. So hi, Yufa. I know you're listening today, and you're in the audience. The new PI is now Bruce Lee on this center. It has domestic and international training, features training in system science, 3 projects that are underneath the center, and a rapid response pilot funding, plenty of training opportunities, postdoc fellowships, things like that. So I invite you to go and explore the website and see if there's training opportunities. There's wonderful seminars on there. I gave one, and there's others that are video casts as a useful source for learning about what's going on in system science. I don't have time to give due diligence to the PRISM, but I'll put these slides here. There are articles written about it. I kind of want to talk about it briefly. This was developed by CDC. I had a very small part in it. We helped co-fund it at the very beginning. They came into a problem of allocating resources. This is a wonderful use of system dynamics modeling to figure out how do you best allocate resources when you have a lot of demands on a lot of different options you could pursue and a lot of outcomes you're interested in looking at. So they wanted to know how to reduce the risk of having a first cardiovascular event, and they had a number of different policies. They're also limited by how much money they could spend, and they also wanted to know, how would this happen over what time frame. So they pursued a system dynamics model to understand how policies, both alone and in combination in the local community, could reduce cardiovascular disease. It was later expanded beyond cardiovascular disease to other chronic diseases. They evaluated, I think at the time this slide was put together, 34 possible interventions in the environment. I think the original one had 10 or 12. So this slide is kind of helps you understand what system dynamics is. So the first thing that's done is there's a collaboration between the modelers and the stakeholders. In this case, the public health department of the local Travis County, Texas public health officials got together, and they kind of mapped up what they thought was going on. And what you see on the far right are the outcomes of interest, cardiovascular disease, deaths, events, and costs. And then that's all in the red on the far right. And then the proximal risk factors, so which would be things like they have trans fat consumption and what else is in there? They have one that says chronic disorders. I think it's hypertension, high cholesterol, and diabetes, and how those feed into uncontrolled, chronic conditions. And I'm having a hard time reading that slide. I'm not sure why that slide didn't turn out, because it's supposed to animate, but I guess the animation did not come through. So if it did animate, and I'll make sure the animation works in the final slide, or I'll get a full slide that's maybe not animated, but shows the purple around the edges, which would be, those are not pictured here, but the purple ones, if they were there, would be all the different interventions the community could do. Like they could put a junk food tax on junk food and sugar sweetened beverages, which would influence diet, which would influence the chronic disorders, which would then ultimately influence cardiovascular events. They could do things like have greater access to care. They could improve the quality of care, meaning health care that people receive. They could have programs to help people manage stress. They could have things to help people, either access to quitting smoking programs or clean indoor air laws. They could have restrictions on pollution, particulate matter. So if they had those, what they did is they took each of those and then they looked at all of them combined and individually. And what they came up with is a variety of things. These are just two graphs that you're going to see. I guess what I should have said about the previous slide was that once they got all that mapped out in a logical kind of diagram, they then went to the literature and put in a quantitative value for a rate of change, a differential equation, calculus, for each of those arrows. Okay, so these are based on what we knew from the literature that's putting now into a calculus. That's how you're going to calculate from a policy all the way through to cardiovascular deaths and costs. Okay, so there is a number crunching behind it that's not shown, but is kind of the guts of it and is a painstaking process. And then what you get are these nice graphs over time. So time is shown on the bottom, and then you get your outcome of interest. So deaths, and each different colored line represents a different combination of policies. And so you see there's a historical graph, which is the blue, and I think these all started in 2008 or something. And so once the intervention is introduced, then you see the line moves after that point. So in other words, you see one blue line all the way up to 2008 or 9 or whatever it was, because that's historical data. And then you see the different lines going forward from 29 or 2010 on, because that's when the interventions were put in. And you can see some lines drop dramatically immediately, and then you can see they also change over time. So if you see the deaths, for example, the deaths might drop immediately but go up over time. And that might be due to the fact that there's an aging population. So even if they could do an intervention that would reduce cardiovascular deaths, because people always are going to be aging, they're going to be, say, for example, the baby boomers coming in and pushing those numbers up, even with an intervention. So it helps you kind of see what are they call it sometimes the bathtub effects, the effects of the momentum of the system that's already going on. And that's really important to understand, and you're not going to necessarily get that if you just take a snapshot of deaths of what's happening without taking into consideration the whole system. The other one is on costs. I'll let you look that up in the article. Just so you know, this is widely disseminated now as PRISM in the Communities Putting Prevention to Work and Community Transformation Grants. Here are the references. This slide didn't turn out either. I'm not sure what happened to my slides, but we'll fix them for the slides that are disseminated to you and posted on the website, because we're going to record this, as I said. We had an annual training that happened for 4 years in a row at Michigan, Columbia University, Mailman School of Public Health, University of Pittsburgh, and Washington University. It's archived. You can't see the website at the bottom, but all of the materials from that are archived. It's a tremendous resource. If you want to learn about system science, you're not going to be able to take these week-long trainings because we're not having them at this point, at least not for the foreseeable future, but you can go back and access the archives. So there should be syllabi, reading lists, lectures, our video casts, lots of great resources. So moving forward, what we're going to be doing is funding these R25s, which are short courses on innovative methodologies in the behavioral and social sciences, including system science. They're under review next week, so we're hoping to fund some. We have enough money to fund 6. They won't all be on system science, but they'll be on a variety of topics relevant to methods for behavioral and social science. So what you might be able to do is take one of these classes once the grantee gets their funding and has time to develop the course. So be on the lookout for that. We do have our bread and butter, the system science and health in the behavioral and social sciences. It's for applied and basic research in system science. And there should be a handout that was given to you. I have it here, but it was emailed to you, so I think Ling has it somewhere. It's called Funding Opportunities and Announcements in System Science. I put that together. It's also available electronically on our website. I'll put the hyperlink to that. Here's one out of that's on the list. It's a cooperative agreement out of National Institute on Biomedical Imaging and Bioengineering. But I did want to call your attention to some influential publications. This one in Health Affairs by Bobby Milstein and others got Paper of the Year. And that's sort of a statement about a field of where we are. It's really come a long way. We wouldn't have had this, 5 years prior. So it's a real testament that system science is coming online. We published this special issue last fall. I invite you to take a look at it. It has a number of good examples of the application of system science. What about the future? I think one big area for the future for system science is big data. These two should get married. Big data is data sets with sizes beyond the ability of commonly used software tools to capture, curate, manage, and process the data within a tolerable elapsed time. So we have a lot of initiatives on big data at NIH called BD2K. I'll talk about it in a minute, big data to knowledge. But there's also part of being big data is complexity in the data. Volume, velocity, variety, and veracity. Those 4 dimensions. And so what I'm saying is, because you see that it's big data is complex data, that's a perfect entree for complex methods like system science. That's why I say they should get married. I'm going to skip these next 3 or 4 slides, except this one. So the other ones are part of our FOA. You can read it there. But big data, I added this. It's not, I don't think, in the FOA, but it's also ubiquitous data. So think of social media data, search history, cell phone data, and that kind of data that's available is relevant to behavioral and social science. When our FOAs at NIH and BD2K talk about big data, it includes behavioral data. It's often called biomedical, but that term includes behavioral and social. So I want people to be aware of that. So I think big data, we'll talk about mHealth in a minute, but big data is this complex, large data phenomenon. mHealth is very useful for kind of capturing that data. mHealth is for mobile health. I'll talk about that in a second. System science, as you know, are the methods for dealing with that. And I think combined between mHealth, big data, and system science, we can address new and different research questions that we haven't been able to before. This slide didn't turn out either, but we have a new director of data science at NIH, Phil Bourne. He's supposed to be here around now, so I'm not sure when he'll arrive. We do have a BD2K initiative. All these slides didn't turn out. We'll make sure they turn out for the real for when I'm posting them. But they really talk about this initiative called BD2K, Big Data to Knowledge. So this slide will ultimately have a website on it that you can go and look at. I think for some reasons these were probably images captured and not all the image showed up for some reason. But at any rate, it's a big push at NIH. It's about 27 million and 14. This is one initiative, this RFA here for centers. That one has already, the call has already ended, and we already have the grants that are under review, or the grant applications under review, but there are many more. There's some in training, there's some in data, I think they call it indexing, which is really, they start out calling it data cataloging, but indexing where the data is to help people find out where the big data is, and some in software development and dissemination of software. And we are participating in most of these initiatives, not every single one of them, but most of them are pertinent to behavioral and social science. There was supposed to be a symposium on data science at NIST, the National Institute of Standards and Technology, last week, but it got snowed out. I think it's this week, or it's either this week or next week. Next week, I think. So you'd have to go look at that. May not have time to attend. Let's move on. I think, unfortunately, a lot of my slides are not coming through. mHealth is mobile technologies. So things like cell phones, but not exclusively cell phones, used to capture data and also to intervene. So for example, delivering interventions over a mobile phone in the moment, for example, to help someone make a better decision about what to eat when they're in a restaurant deciding what to select from the menu. Or for example, helping them prevent relapse because your cell phone knows that you're near a bar and you might either smoke or drink if you go in there. Those kind of things. I think these are the rest of these slides that are kind of missing are examples of the applications from mobile health. This is an adherence one, for example, how people in remote places, you can capture their adherence. It's I think a pill box that's monitoring when it's opened and closed to take medication, and if it's not open, that means the person didn't take their medication, which means they can be contacted immediately if it's flagged in real time to be reminded that they need to take their HIV medication, for example. We can use mobile phones to detect bouts of activity because they already have an accelerometer built in. So this is just mapping people's physical activity across a city space. Might be able to help you identify where are the good places and the places that need to be improved if you want public or people to be physically active along those routes. This is another one measuring commuting patterns and exposure in those commuting patterns to carbon monoxide. This is just an example of a device that's being developed to capture 5,500 photos a day, also incorporating GPS and Bluetooth, so that we have all kind of devices. The technology, I think, at this point in mHealth is ahead of where we are with methods, and we need to catch up. So how can mHealth be used? Well, it can be used for models of individual behavior, predicting when a person will be likely to relapse, for example, based on patterns that have been collected on that individual in the past. It can be used for regrounding models in real time so that our computational simulation models are updated based on the data that are currently available, much like you see with hurricanes. The weather forecasters constantly talk about, well, the model, new data has come in and the model's been updated, and so now the path is swerved to the right or the left or whatever. Challenges, of course, include data privacy, security, and data integration. And other search terms you might be thinking about when you're looking at mHealth, you might think about intensive longitudinal data, ecological momentary assessment. One of our other presenters today, Liz Ginexi, and I just had a article, I don't know if it's been published yet, but it's in nicotine tobacco research. This month or next, in nicotine tobacco research on that topic. You could take a look at. So there's training available. I don't have time to go through these because I think I'm out of time. But there's a lot more that could be done in dissemination and implementation research. Goal setting, if you're interested in goal setting, such as Healthy People 2020, whatever, pick your year. Look at the Levy paper. It's myself, David Levy, myself, and others in a AJPH 2010 article. And identify, we could be used to identify and prioritize research needs. We had a tobacco modeling workshop that needs some follow-up. I recommend anybody who's in a federal agency to pick up that ball. I'll be leaving OBSSR, and somebody will need to carry that torch. But before I leave, we'll be publishing, or after I leave, we'll be publishing this special issue in the American Journal of Public Health on obesity and system science. So keep an eye out for that, due out June or July 2014. We also have an interest in modeling the scientific workforce. There's going to be, there is an RFA out. The applications are under review. So more needed to be done in system science. We need to do more on verification and validation. We need to do more in terms of getting data to feed our models, including longitudinal data on social networks. We need, I think, these areas are ripe for system science, intergenerational transmission of disadvantage. And Nate Osgood has a paper referenced at the bottom of the slide on the intergenerational transmission of diabetes that might give people some ideas about how to model intergenerational transmission of disadvantage. There's also a lot needed to be done on geographical aspects of health disparities. Some health disparities tend to endure within a specific geographical region. We need to better understand why that is. We need to know more about gene and environment interactions. I think the work by Ross Hammond is a wonderful start in that area. It's the only area that I know that anybody's doing system science to explore those kinds of questions. So it's a wide open frontier there. And we need decision tools like the one you saw for PRISM to be developed for vulnerable communities. And in fact, for anybody who's got limited resources, which is just about all of us, none of us have infinite resources, and have decisions to make based on a lot of good evidence. Okay, in conclusion, I'm just going to say, read the resources that are in these slides, take any kind of training that you can, serve on review committees, submit your CV to the SRO. Most of it is Tomasz Dragon. Apply for funding. If you apply, NIH will know you're interested in system science. People who say, well, I'm not going to apply because I don't think NIH will fund it, then we don't even know you're out there. So you have to come to us. If you're a federal person, include system science language in your funding announcements. Take the time to find a collaborator. Like I mentioned, come to SBP, join the listserv, and be an evangelist for system science. So to get on the listserv, just email me. My email will be at the end of the slides. Here's some must-reads. I'll leave these for you to read later. There's information on the conference I mentioned. People at OBSSR you might want to contact: for BD2K, Erica Spots; for mHealth, Wendy Nilsson; for workforce modeling, Mike Spittle; for dissemination and implementation, a new staff person, Deborah Young-Hyman. Our director is Bob Kaplan. And the future of system science depends on you. I am going to be departing on March 24th for a new job at the NIH Office of Disease Prevention. So you can join our wonderful team here. Somebody has to come take the mantle for system science, so might as well be you, right? And there's my contact information. So I'm sorry I ran over. I'm done. Ling?
Okay. Could you introduce other
Sure.
NIH
Greg, come on up.
Thank you.
Do you have my slides?
Oh, I sent them to you. Okay. We don't have the slides right yet, but we're getting them prepared. So our first, I'll introduce everybody while we're getting the slides set up. So we have a number of panelists joining us today. I wanted to let you know that unfortunately, one of our panelists had a death in the family and was unable to make it today. That's Bethany Deeds, and she's a deputy branch chief within epidemiology research branch in the Division of Epidemiology Services and Prevention Research at the National Institute on Drug Abuse. So I will be presenting her slides once they're available. Our second panelist, who's going to be the first presenter, is Gregory Bloss. He is a program director for policy and economic studies. What are we doing? The keyboard. He is the program director for policy and economic studies in the Division of Epidemiology and Prevention Research at the National Institute on Alcohol Abuse and Alcoholism, NIAAA. I think you have the bios, so I'm not going to read each of them. Regina Burris, I assume, will be joining us later. She is in the Population Dynamics branch at the National Institute on Child Health and Human Development. David Clark is a program officer in the Behavioral and Social Sciences Research branch in the National Institute of Dental and Craniofacial Research, NIDCR. And Liz Ginexi is a program director in the Tobacco Control Research branch in the National Cancer Institute. So Greg, we're going to let you take it away without your slides and make it as far as you can. What do you think?
I think they're ready to go.
You think the slides are ready now? Okay. Okay, have a seat.
There we are.
You're amazing.
Nicely done. Outstanding.
Good job.
And what do I use here? The little arrows?
Yeah, the side arrow, not the down. Side.
Okay. Hi, my name is Greg Bloss. As Patty said, I'm from the National Institute on Alcohol Abuse and Alcoholism. Very happy to have a chance to talk to you today. Thanks to Patty for inviting me, and especially thanks to Patty for her incredible energy and leadership in this area over quite a long time. We've all benefited from that. I'm just going to say a few words today about why I think alcohol consumption and alcohol-related problems are an area that are promising and ripe for application of system science methods. I'll hurry up and try and stick within my 5 minutes. The basic underlying reasoning is that, first, alcohol-related problems are very important from a public health point of view. I'm not going to belabor that today. I'm going to spend a couple minutes talking about the directions in which complexity infuses alcohol-related behaviors and outcomes. But together, the importance and the complexity make this an interesting and a worthwhile area for you to invest your research energies. Finally, this is an area where system science has not had as much application as some others. It's significantly underdeveloped compared to some others that have gotten more system science attention, especially I'm thinking of obesity and tobacco research, which have benefited from this. So there's room to make a genuine contribution here. Most researchers are aware that alcohol causes substantial problems, even as it's something that many people enjoy. There's a lot of public health adverse consequences, many deaths. Many people suffer clinical disorders related to alcohol consumption. There's very large economic costs. Any measure of burden of disease, alcohol tends to come up very high on that, and it's easy to find information on that. So I'm just not going to spend the time. When we're talking about system science methods, as Patty explained, complexity is one of the things that systems tools like agent-based modeling, like network analysis, really have an advantage to be able to get at the multidirectional and interacting effects of different influences. So if you think of drinking behavior, there are many factors that contribute to decisions about drinking behavior. Some of those are intrinsic to the individual. Some of those are extrinsic in terms of social norms or the policy environment. There's contextual influences such as the time and place. All these things interact in different ways. When you think of the consequences of drinking, now we attend to primarily the adverse consequences, and especially in the health area, there are many, and they're diverse. In the health area, there are acute consequences associated with intoxication. The one that we all think of is traffic crashes, but there are others like burns and falls, intentional injuries, homicide and suicide. Also chronic health outcomes, chronic diseases, especially alcoholic liver disease, but also a number of forms of cancer and various other conditions. There are other things that are not directly health outcomes, but things like healthcare utilization or interpersonal effects on marriages, on families, social, legal outcomes, economic outcomes, things that happen in the workplace. These are all have the potential to exhibit interactions with one another. And so underlying this is the deep heterogeneity of these things. So people in similar settings with similar backgrounds will exhibit different drinking behaviors. People who exhibit similar drinking behaviors will experience different kinds of outcomes. The heterogeneity is in multiple different dimensions, including those that we're familiar with in analysis, like age, sex, and race, but also in terms of a variety of other characteristics that are associated with alcohol, like the patterns of drinking, the role of volition in addiction, the susceptibility to risks, and so forth. So heterogeneity is one of the things that really makes system science a tool that provides an opportunity to gain insights that we have not been able to get before. Standard reductive methods that focus on the mean effect or the typical individual just don't really have the opportunity to take full advantage of that. Finally, I want to point to the multiple scales that are relevant in this. There's the physical size scale, micro to macro. My institute has supported research across this entire range for many years. Molecular, cellular, organs, organ systems, notably in particular the brain, things at the individual level, but then moving on up to larger aggregates with family groups, community, workplace, population level outcomes. So there are different lenses that you can bring to bear on this. Also different temporal scales. We've commonly measured alcohol consumption and outcomes in terms of last year, last month, last 2 weeks. With the advent of more and better data collection opportunities, especially some of the big data kinds of things, there's an opportunity to look more closely at decisions that are made on a daily basis or even at a finer grain level than that. Momentary decisions of whether to have another drink. This is a frontier that has not really been explored very much, something that I think has a great potential for giving us insights. Finally, I just point to the life cycle perspective because the behaviors and risks are different at different stages of the life cycle. I'm going to skip right past most of this stuff to say we've funded only a few projects in this area, but we are interested in pursuing this. A little bit of Googling will help you identify a few key publications, one here in agent-based perspective, one from a system dynamics or compartmental perspective, one from a network analysis perspective. That last one is in the Christakis and Fowler tradition, the spread of alcohol consumption behavior in a large network. These are now a little bit old, but I point them out because they'll help to direct you to where the literature has gone. Most of our funding announcements do have some mention of system science, even if that's not their primary focus, but we participate in most, if not all, of the trans NIH funding announcements that focus specifically on system science modeling. And I'd be very interested to talk to you if you're thinking of trying to pursue research in this area. So there's my contact information. And thank you very much.
Yay.
David, are you up next?
Sure.
Patty?
Yes.
Link. It's my understanding Greg going to take questions before other
Sure. Well, I'd be happy to take questions now. I do have to cut out about 20 minutes from now. So if there are questions specifically for me, I'd be happy to answer those.
questions from the audience for NIAAA.
I like the other picture better.
Very stately.
Well, Greg, we'll let you go.
Okay. That was an easy one.
Thank you, Greg. Thank you for coming.
My pleasure.
How many people are on the other end?
Yeah, is it?
Oh,
It's a lot of people.
yeah, and it's going to be web recorded, so there'll be
Even better.
there'll
Okay.
be more people later.
So I'm Dave Clark. I'm at the in the Behavioral and Social Sciences Research Branch at the National Institute of Dental and Craniofacial Research. I did not make slides because my message should be fairly simple. If you have a system science idea that relates to prevention of oral disease, management of craniofacial disorders, I want to hear from you. So what I want you to do is to get on email and send me a message, because what we've found is the best way is to talk with applicants about your ideas to make sure that what you're thinking about doing fits within the mission of the NIDCR, and also to help fill in blanks if you need to, and just kind of, we want to be able to be helpful to you to make sure that you put your best foot forward when you get your applications in. Patty asked that I do mention some of our success stories, because we have supported, we've awarded grants that came through the PARs that Patty was able to put forward, which we were very, very appreciative, by the way. The first one I'll mention is a little bit more tangential to you guys up in Buffalo, is the Deb Polk application. She's at the University of Pittsburgh. She is doing some great work with systems, dynamics modeling, and pediatric toothbrushing, to look at what are the levers that can be used to help promote toothbrushing within children. And the one that may be a little bit more relevant to you is it was an R21 followed by an R01 by Mary Northridge she's at NYU now. She was at Columbia for a while. But never enough about Mary. In addition to Mary is Carol Kunzel, who's up at Columbia, and then more importantly is Sarah Metcalf, who's at Buffalo. So Sarah, if you're in the audience, please stand up so everyone can take a look at what an awesome R01 funded NIDCR researcher looks like. That would be great. So like I said, bottom line is, if you have an idea that you think may be related to the NIDCR mission, please go to our website. I have a terrible, tragically bad picture of me on there with my email underneath. So forget the picture, click the email, send me a message. We will set up a time to talk and make sure that your ideas are relevant to the mission. We can get you in the right path. Okay.
Thank you.
Yay. And now, Liz, you're up.
Well, thank you, Dave.
Welcome. Do we know, Patty, if you sent any of our handouts
I
along?
sent them all. Ask Ling if
Okay.
she has them. Ask
Okay.
Ling.
What I'm holding up is hopefully a handout that you all may have received from me about the NCI Behavioral Research Program. And here we go. So, as Patty mentioned, NCI has been involved in a lot of system science related research for quite some time, and we are continuing as leaders in that as well. So we don't consider that the fact that we started early that means we're done. On the contrary, there's a lot to do, and some of the things that Patty mentioned, I was involved in helping, for example, the tobacco modeling workshop, and I do need to talk to Patty about that because we're very interested in pursuing that further. And in my portfolio today, I actually have some bona fide system science modeling going on for real that's being funded by the NCI. In particular, I can mention just a couple, Scott Leischow and his colleague Greg Moore. They are out of Mayo Clinic in Arizona. They have an R01 that has been using social network analysis to look at the spread of evidence-based cessation information through the North American quit lines. So these are, all of the quit lines are through the United States and up into Canada, and they're all networked to each other. And when new practice guidelines come out about how to help people quit smoking, the idea is that they get pushed to the quit lines. But unfortunately, sometimes it stops, and so it doesn't get to the outer nodes or the more remote places. So they've been really studying this and trying to figure out ways to get the evidence-based practice out. And then a second grant that I'll quickly mention is being conducted right now by Doug Luke, and he's at Washington University in Missouri, and WashU. He's developed along with Ross Hammond, in fact, they're starting to develop a agent-based model called Tobacco Town. And the purpose of this is that we know that the retail environment, proximity to schools, how tobacco retail outlets are distributed density-wise, and how the advertising and marketing and all the different factors can influence the prevalence of smoking behaviors, particularly among youth in areas, is pretty complicated. And so as folks like FDA or states and local communities try and decide what to do, we really need to understand what's going on. So they're creating a little village called Tobacco Town that's being modeled based on epidemiological data and retail data, and it's really cool. So no publications yet, but we hope to see some of that soon. Just so you know where you would come for behavioral research at the NCI, we're housed in the Division of Cancer Control and Population Sciences, and I've put a red circle or oval around the behavioral research program, which is described on this flyer which I sent you. And we have 6 branches now. We added one just about a year ago, which is of particular relevance to you all, called the Science of Research and Technology branch. I have a joint appointment in both the Tobacco Control branch and that branch, and that branch is really interested in encouraging the development and utilization of new methodologies. So that's one to look for. These are the branch chiefs of each of these. We have a keen interest in all of the factors behaviorally related to cancer control and prevention. So you'll see the basic biobehavioral and psychological sciences branch, health behaviors research branch, health communications and informatics research branch, process of care research branch, science of research and technology, and tobacco control. And here's a little bit about our aims for our program. As you can see, there's a variety of behaviors that are related to cancer prevention and control, and any number of these could be fodder for system science models. My branch that I am primarily housed in is the Tobacco Control Research Branch, and of course we are interested in fighting tobacco, as you can see, and I do have some grants already in my portfolio that use system science models. But here's some of the reasons why we're not done yet. Tobacco control is a moving target. Once we figure out something that works, the industry gives us new products and new things are happening. Vulnerable groups are changing or becoming even more vulnerable, and we have all of these strange levels of smoking that we don't know how to measure and how to deal with, like non-daily smoking and people who are dual smoking different products. The whole area of secondhand smoke exposure is exploding as the new frontier in tobacco control. We're looking at things like multi-unit housing and smoking in cars and all these areas which may have been considered before untouchable are now considered good sources of ways to protect children who are the most vulnerable for secondhand smoke exposure and cancer-related illness. So then layer on top of that, FDA is now has regulatory authority over tobacco products and marketing, so they need information on what to do, and modeling is already starting to be helpful for them and will be more so. And then if you take it all the way out to the world, what's happening in different countries can inform us, and there's a role for modeling there as well. If you have questions, I'm thrilled to talk to you. You can shoot me an email here or go on our website, and my phone number's up there. I'm sorry I didn't put my phone number up here. I never remember it. But I just don't remember my phone number because I keep changing them. But that email will get you to me, and I'm happy to have a conversation with you, and or put you in touch with some of my colleagues who are in the behavioral research program if you're not necessarily interested in tobacco as your behavior, but maybe you're interested in physical activity, sun safety, any number of the variables that are related to cancer. We're happy to speak with you. Right?
Okay, thank you, Liz. Okay, so, can you pull up the one from Bethany? So I'm going to try to do justice to Bethany Deeds, who's not here to join us to do the 5-minute presentation on NIDA, but I'm waiting for the slides, and no, I don't know the material. If she can't get the slides up, then that's okay. Maybe what we should do is take the Q&A for now. Oh, she needs the keyboard. Why don't we start with Q&A for those of us who've already gone, and the other person that I'm not sure, Regina Burris, she did send her information, and she sent a handout, so I hope you all got that, but she's not here today. Let me just say that both Bethany Deeds at NIDA and Regina Burris at NICHD have been wonderful champions of system science, and both of them have grantees in their portfolios who have been funded for system science. So if you have anything that fits within the handout for Regina Burris, contact her. She's specifically, I know her through obesity, but she and her branch have interests far beyond childhood obesity or obesity. They've got a lot of interest in population dynamics in general, demography in general. Bethany, I know that for sure, even though they are not signed on, it's important to know they're not signed on to the PAR out of OBSSR on system science and health and the behavioral and social sciences, PAR 11, 314, and 315. They are interested. Yeah, here's Bethany's. So she's very interested. So let's go ahead and present her slides. Not yet. They're coming. They're on the way. But they are very interested in system science methods. There are other reasons why they may not have been able to participate in our funding announcement. So I think we're ready to get that one. Almost. Thank you for your patience as we bring it up. That one. Okay, here we go. Do some Q&A. Okay, we're told to do Q&A. So based on the presentations we've had so far,
one thing I can mention, the system science PAs, the program announcements, are good, but I've had modeling come in on some other notable ones. In particular, the dissemination implementation science program announcement is the one that Doug Luke used for his Tobacco Town agent-based modeling. And the idea is that, it's related to implementation of policy and community, and how do you know which ones are going to work, and how do you know what to disseminate? And here we're using a systems model to inform dissemination and implementation. So just to let people know that if you talk with us, we can be creative about which program announcement to advise you to go to based on your questions.
This is really good information. Mm-hmm. One of the things that people tend to forget is that we have other announcements other than the system science ones. Right. The advantage of the system science one is that you get the special emphasis panel, but as Liz has pointed out, others are other panels are open to this and they have gotten good enough scores to get funded. But that does bring up one point that I forgot to mention, which is I had a second handout. It's called Patty Mabry's resource page for NIH grant applicants, and I think, Greg, you distributed one as well, a resource page, a handout.
I don't think I sent it here, but I have one for anybody who's interested in it, just general
Okay.
overview about grants processes and links to a lot of sites.
Yeah, and I
that are
think
useful.
Regina had one. So anyway, these are all useful. I think each of them will probably highlight some different aspect and bring up something different. So I would strongly encourage you to pay attention to the handouts, even though we're not going over them in great detail. Are we ready at this point?
Let me
ready.
jump in with one thing, because the question of which funding announcement you respond to is, people worry about that a lot, and for most of the program announcements, I say it doesn't really matter all that much. It matters more which review group you're going to go to.
Absolutely.
But for some of these announcements, they're PARs, and so that determines which review group you're going to go to. So if you're going to go to a review group that is stocked with people who are familiar with system science, you may not have to put as much energy on convincing them that system science is a legitimate analytic tool for addressing a question, and maybe a little more emphasis on what is the significance of the question that you're addressing. In my institute, we have some dedicated review groups that are stocked with researchers who are familiar with alcohol problems, and so if you go there, you may not have to spend as much of your energy on convincing them that alcohol is an important issue to study and why you're addressing that, and a little more on what's the value of using the methodology that you're bringing there.
Thank you.
If
Thank you.
and to follow on to that point of what Greg is saying is that don't be afraid if you end up at a study section or in a review group that that's not necessarily the special emphasis panel. Because one of the things you can do is you can request that specific expertise be a part of the review, and you can contact the the review official in advance of the review to say, I would like to have specific expertise present for a fair review of my application. So, like Greg said, we have the same issue with the NIDCR. We have panels that they're brilliant dental researchers, but don't necessarily understand some of this methodologies like we've talked about today. So if you ask specifically for our review officers to say, I would request to have an expert in agent-based modeling or whatever you happen to be doing, we can make sure that that's present on the panel.
Okay, great. Good points, everyone. Speaking of which, I did want to make one other point that I'm not sure I mentioned. For the system science and health and the behavioral and social sciences that I've been touting, it's the first one listed on the funding opportunities page. That one expires September of 2014, but we do plan to reissue. Just letting you know, we do plan to reissue that. Okay, so let's go ahead and go to Bethany's slides, and I apologize that you're not going to get as good of a presentation as you would get from me. So, funding opportunities at the National Institute of Drug Abuse. So, let's see, there's a substance use cycle. I do not know these slides, so I apologize for that, but I know they do have an interest in prevention and services research, as well as etiology, treatment, and understanding genetics, epigenetics, consequences of substance use. So pretty much the door is wide open for any topic within substance use. Their priority areas are prevention, treatment, and consequences as outlined here. And I think this is what I wanted to get to. The funding opportunities that they have. They have one called Epidemiology of Drug Abuse. Another one, Accelerating the Pace of Drug Abuse Research Using Existing Epidemiology, Prevention, and Treatment Research Data. And in both of these cases, these are, well, I guess the first one is R01, R21, and R03. The second one is an R01. But they're aiming at, they include innovative methods or techniques that are novel to drug abuse research, such as network analysis, agent-based modeling, system dynamics modeling. So these funding announcements call out very specifically the system science methods. So again, don't limit yourself just to the system science funding announcement. Here's another one, using social media to understand and address substance use and addiction. And these are RFAs, which means the money is set aside. It's an R01 and an R21. So the difference is when money is not set aside for a program announcement, they will compete in the general pool of applications, and these will compete only against the other applications that come in under that funding announcement. Due March 25th, by the way. So this is a very good slide because I think everyone should be in the habit of, when you're developing an idea for the NIH to apply, you should develop a concept paper. This is sort of your little flyer or your calling card that you can distribute among the program officers at NIH to get them interested in your idea. This is a nice way to lay it out. It shouldn't be more than a page or two. You should have your study goals, the significance of the problem, the research question, a little bit about your design and analysis, and who the key investigators are. So I think this is her final slide. She gives you some wonderful resources that you can go to, including the Center for Scientific Review. NIH Reporter, by the way, is our database of funded research. It's a wonderful way to search for who's doing what that isn't published yet, so you can kind of identify what the cutting edge topics are in the field and who may already be doing it. You may also find it useful for differentiating the proposed work you have from what other people are being funded to do. It's also a great way to identify collaborators who you might want to work with. A final use of it, I think, is to identify which institute or center or what part of NIH may be interested in your work. If you find that there's a specific institute that's supporting someone else's work that's similar, they may be also interested in your work. It might tell you who you should be talking to. So I think that's it. She has a nice little slide, and the one statistician is talking to the person who's in his office saying, I can prove it or disprove it. What do you want me to do? And she's saying that's not an example of how to do science. Okay, a little humor. Okay, so I think we need to start taking some questions here. So let's hear it from the audience. Hello?
Hello, this is Chen Wang from the Department of Civil Engineering at University of Buffalo. I never submitted any proposal to NIH, but always interested. So in this case, if I have an idea and looking for some potential collaborators, do you have any online sources or databases so that I can find the expertise?
For identifying a collaborator?
Yes.
So I think there's a couple of ways to do that. I'll let Liz and David answer. I'm sorry that Greg had to leave early. I'm going to invite Liz and David to come sit with me so that we can all be on the camera so that you don't feel like you're talking to a black box. But as far as identifying collaborators, I'll let David and Liz share their ideas. But my idea is, I'm sorry, I always forget that Dave prefers Dave to David, but
It's fine.
I have a lot of Daves and Davids in my life, including my father, and I can't keep them all straight. So as to how to identify collaborators, I would say one useful way is to see who is at your own university. You may be able to talk to your own Office of Grants and Contracts and see who they might be able to identify who's doing the kind of work that you're interested in. So for example, you may not be interested, if you're studying obesity, you may not be looking for an obesity expert. You may be interested in finding a system science expert. Or on the other hand, you may be interested in finding another person doing obesity, but that's one way. Another way is to go to meetings, like I mentioned, SBP, at least in terms of finding a system scientist. That's a great place to go. Another way, as I just had mentioned, is looking at NIH Reporter and trying to find through the funded database of NIH research who else, either by geography or institution or topic area, of course, or funded under a similar project, might be doing the same work, similar work, or whatever type of work you're looking for. I think something else to keep in mind for a new person, like you said you were a new investigator who has not yet come to NIH, I strongly suggest that you work with someone who's already had NIH funding, preferably RO1 level funding. So that there's nothing like learning from somebody who's already knows the ropes. So I'm going to get out of the way so these other two can answer. Please.
Yeah,
Squeeze around the
absolutely.
table.
I think
You have to be close.
the best ways to make connections are going to be through
Go ahead.
the scientists at your own institution. So hook up with the folks who have NIH funding now at your institution. Learn from them how they write grants, how they got their grants, how they got started. Go to professional meetings on the topics that you're interested in. Whatever disease area or prevention or treatment area that is of where the funded people go for your topic. So I'm sure there are key professional societies for dental research. In my field, in tobacco prevention, people will go to SRNT, Society for Research on Nicotine and Tobacco. They'll go to APHA, American Public Health, and many, many others. So you can network, go to see talks and so forth. You're not going to, I don't think, have very much luck by cold calling people and saying, hey, I'm so-and-so, you don't know me, but will you partner with an RO1 with me? It's just not, it's not likely to happen, so.
Yeah, what they said, plus additionally, yeah, and I don't want to speak for all the NIH institutes, but I know at the NIDCR, we are not above playing NIHmatch.com. So if you have an idea and you're not sure who to collaborate with, if you give us if you send us an email and set up a time to talk with us, we can potentially try to find someone who may or may not be a good match for you, but at least we might be able to put you in the right direction.
Okay, who's next?
Let's get to the mic.
You can't see.
Hi, Patty and Elizabeth and David. And my name is Gary Giovino. I'm at Buffalo now. And my question, I really don't consider myself a system scientist, although listening to you talk, I'm getting jazzed up a little. And I'm wondering, one question I have is, I've developed interest in a couple of things, not just tobacco. I've been a tobacco researcher for a long time, but also in food and in the built environment and how they might interact. And I could see that as a system
Definitely.
type analysis. And Yufa Wang's here, and I'm starting to work with him now, so that's helpful. But I'm wondering where I might direct, if we decided to go forward with a proposal that might include those three areas, where would you recommend sending?
That's a great question. Okay, so I'm going to swap with Liz again.
Yeah.
So first of all, hi Gary. So we've known each other for a while, and it's good to hear you, even if I can't see you. I would say for this type of topic, the best person to start with is going to be Regina Burris. She's definitely done stuff with the built environment, obesity, and if I'd say another place to go is NHLBI. So the person I recommend is Sonia Artiega. I'm looking to see if I have her listed on my sheet here. Let's see, NHLBI. I have Lawton Cooper listed. He's also a good person to talk to at NHLBI. But Sonia Artiega, if you email me, Gary, I'll send you her contact information. And it doesn't hurt to call multiple institutes because you're kind of increasing your odds that somebody will be interested in it. I think NCI might be interested, but I think the key, and Liz can speak about this, but you have to tie it directly to cancer. So go ahead.
Right. So we have a lot of interest, as you know, in physical activity and food and all those behaviors that might relate to cancer risk. So it's not out of the question to come to us. Who to talk to? Probably want to talk to someone like Heather Patrick,
Oh, okay.
or maybe Audi Atienza or
Okay.
somebody like that.
Okay, so maybe if you start with Liz, she can point you to the right person.
Right.
Yes. And then another institute of ours that's big on this topic would be NIDDK. I don't think I listed anybody from NIDDK on here, probably because we don't have them participating on our announcement, but that doesn't mean they may not be interested. The person that I would start with is Christine Hunter. Again, if you email me and ask me for contacts at NHLBI and NIDDK and NICHD, and then you can talk to Liz about NCI in terms of this topic, I'd be happy to send you those names.
And I think the key is to also to maybe spend a little time with the reporter tool, or on our NCI website you can look up our funded grants and see who's already doing models in this area, because that'll help you identify what the gaps are. Not knowing what we've already funded, the NIH has already funded in terms of these kinds of models, because you won't be the first one doing this. 10 years ago, you might have been the first one doing this, right?
Exactly.
So, and CDC's done a lot in this as well. So there's probably a bunch of literature that you'll need to get up to speed on.
I'm not coming up with any brilliant ideas off the top of my head, Gary, as far as collaborating, but certainly the Envision members, that's a public website, and you can go and look and see who the Envision members are. The publications page for Envision, I'm in the middle of updating that, and when I send these slides out, I'll have it updated and I'll include it as part of this presentation, and then you can go and look at Envision and see what they've published in terms of system science applications to obesity. So that's at least one source, pretty solid source that we have for that. And you're also talking to UFA, and he's very familiar with the Hopkins Center, so that's a great collaboration right there. Next.
That's all very helpful. Thank you, Patty. I'll be emailing you.
Okay, thank you. Next question.
Hi, thank you for giving this seminar. It's really good today. My question is about the necessarily interdisciplinary nature of this work, and whether it's better to go for a co-PI model or to have a single lead PI with everybody else being co-Is or subcontract, and do you lead with the disease expert, do you lead with the modeling expert? What is the more preferred format?
That's a wonderful question, and you're absolutely right. I did not emphasize it in my talk today, but this is absolutely 100% true. When you do system science, it's almost by its very nature interdisciplinary, because you're talking about the whole system, and what you tend to have is people who are experts in one part or another part of the system, and you're kind of bringing them all together. I think as far as PI, I'm not sure. I think that one thing you should be aware of is, and everyone should be aware of, is that we do have multiple PI opportunity at NIH, so you don't have to pick one. I don't know, I'll let the other two talk more about that. They're probably more familiar with what may or may not be allowed as far as multiple PIs, but I think in general they're allowed and encouraged. As far as who to make the lead PI, I've seen a lot of applications come in with 3 or 4 PIs on them, 2, 3, and 4 PIs. I don't know that it is if you have a team like that, if you really need to say who's a lead, it's more about saying what each one's contribution is to the whole. And so as far as the modeler person goes, I think what you want to convey is that they have the expertise to carry out this method, and then even if they haven't worked in this topic area before, they've worked with this method before, and maybe show some of the work they've done, even if it's in a different topic area, to demonstrate that they know the technique, that they are a bona fide expert. I don't know what the others might think about that.
I would say 2 things. First of all, if you are a great grant writer but have never gotten an R01 before, it might be a good idea to make that person the PI, because we have a goal of trying to fund new investigators. So as long as your collaborators are solid and you have a wonderful team who can carry it out, if you're the new grantee who's never had an R01 before, we can often reach you and fund you with a slightly higher score. So that is one thing I can say for sure. On the other hand, if you're too inexperienced to really be believable as the PI yet, then I would encourage you to put the more senior person on. And then the third option is multi-PI. Multi-PI doesn't solve the problem of having, not enough experience, however. So, and it also requires an additional section in your grant to have a plan for how you deal with multi-PI. So you're creating more work for yourself. I would only do multi-PI if you really need it.
And the multiple PI application, if only one of the multiple PIs is new investigator, you lose that kind of new investigator
Absolutely.
bonus. So that's something to consider.
So new investigator confers advantage. I know for sure at my institute, and pretty much should be at all the other institutes, we are essentially congressionally urged, let's put it that way, to fund as many new investigators as we can. So the way that we do that is we cut them a little slack.
And the other thing I might add is that as I've listened to many study sections, is that one of the things I think that I hear, and I could be mishearing this, is that they're not really interested so much in who is necessarily the lead. They want to make sure that the team has all of the relevant expertise at the right levels. And I've heard them go both directions. I've heard them complain that someone is on maybe too much, another person's on too little. So they really, in my opinion, in my experience, I think reviewers really spend a lot of time looking to make sure that the right people at the right level.
Okay, that was great. Thank you very much.
You're welcome.
You kind of touched on this. We have a host of experience on Markov models. We've never actually applied it to system science, but this seems very intriguing. But you don't think this would be an issue, taking our Markov model experience and just moving it over a bit?
Well, so if you're talking about taking your Markov modeling experience from one topic and applying it to a different content area, that should be fine.
Yes. Okay. Great. Thank you very much.
But you want to make sure that the topic area people you have are, as David said, the right level of people, experts. Next.
Hi, Patty. This is Sean Wu at Buffalo. I have a quick question. Where we can get your slides today?
Oh, hi. Thank you. Thank you.
Your slides.
So I don't have them up yet, but I'll make sure that I do two things. One, I will put them on our website, and I will put a hyperlink to the website on the listserv. So you're on our listserv, right? You're on the listserv? Okay, so that's one way. The other way...
He said, Patty, he said he would sign up to it.
Okay, good. The other way is Ling. I will send it directly to you, and you can then have it if people ask for it, or you can post it at Buffalo, or whatever you want to do with that. We are video casting, or videotaping, I should say this, and we're going to also put the video footage on the website as well. So that'll be also on the listserv, and I will also send that to Ling.
Yeah, thank you, Patty. We'll disseminate the URL.
Next.
Hi, Patty. This is Chen again. Because I'm kind of new to NIH, so I have a lot of questions. Can you briefly explain your review process? Let's say, for example, in your panel, usually how many panel members involved, what kind of expertise they have, or, and also what kind of steps you pursue to pick the best proposals and so on.
So I think this is probably a pretty long answer, but to give you some of the short answer, I would point you to the CSR website. This is the Center for Scientific Review at NIH, and they used to have, and they probably still do, videotapes of mock review. I would strongly recommend you watch those, given your question, and it will explain the review process in terms of you'll actually see people reviewing a grant, so you'll see what happens to grant applications Now, it's not a real one. It's quote unquote mock. They're actors, but the process is very realistic. The other thing that the website has, and I'm not sure if it's on the CSR website or the OER website, or it's probably somewhere in the resource page. I'll see if I can find it. But yeah, NIH peer review is listed. So it's, yeah, it says there's a video. So if you look at that, it's on the very last page of the thing called Patty Mabry's research page for grant applicants. The very last page at the top, NIH review, peer review. So that'll tell you more. There's also a page, I think it's from OER, that talks about, yeah, so if you go to the preceding page, there's a link called Grants Process. And so what that does is shows you visually, step by step, what happens to your application when it comes to NIH and at each stage along the way. So in short, your application comes to NIH after you've talked to your program officer, hopefully, and written it up and done a nice good job and everything like that and submitted it. It will come to NIH and it goes to the Division of Receipt and Referral, where it's assigned to an institute or a center who is then in line to fund it should it get a good score. Then it goes over to the Center for Scientific Review, where they, or simultaneously, where they have a person called a SRO, Scientific Review Officer, who will look at all the applications that have come in under the particular funding announcement, if it's a special emphasis panel, or the study section is a little different. The SRO basically is in charge of finding reviewers that can review the content of your application. Say, for example, you're doing an agent-based modeling in obesity. They'll want to get the proper obesity experts. For example, maybe they're going to be at the metabolism level, or maybe at the policy level. Whatever is the right obesity type of expert to review, they will get that. And then if it's, say, like I said, an agent-based model, they will be responsible to getting the agent-based modeling expertise also represented to review your grant. Usually most applications have 3 grant reviewers, a primary, a secondary, and a tertiary, but sometimes they might have 4 grant reviewers. But everybody on the panel can range in size depending on the number of applications that are being reviewed, but I'd say anywhere from 12 to 20 is probably a fairly good number, a modal number for review size. But all of the members who are on the panel will be responsible for giving your grant a score. It's more involved than all of that, but I think if you go and look at the grant process link, you'll get a good idea. But I'll let my colleagues jump in with any additional information.
Again, the best thing to recommend is to find a PI at your institution who's gone through the process and talk with them about their experiences. And NIH review is held up as a model for scientific biomedical research review, but you don't want to submit a grant knowing nothing about it, and you definitely want to talk A, to someone who's experienced at your institution, also B, to someone like myself and Dave who can help you select the right review group and make sure that your grant gets the best chance.
And so the only thing I would add to what Liz said, which was absolutely correct, is if you talk to someone who's had a lot of success in achieving NIH funding, they may be someone who's actually served on a study section as well and can give you that level of insight.
Absolutely. Okay, thank you. Thank you, Chen. Next?
Yes, thank you for the information. I have another question.
Okay.
I'm sure, during the review process, you have many criteria. So I was wondering how much you weigh or evaluate this interdisciplinary research. For example, according to your statistics, so how many research projects actually interdisciplinary funded by your program? I think that we don't really have a program for interdisciplinary here at OBSSR, but that doesn't mean it's not valued. As far as how it weighs in the criteria, there's not a specific criteria for interdisciplinarity. I think your best bet is make a compelling case that the only way for your problem to be, or the best way for your problem to be addressed, is with a team that has experts in multiple areas. But I'll let Liz and Dave weigh in.
To the best of my knowledge, there's no formula at all that says you should have X% of people that are in this discipline and X% in another discipline. It's really because your job as an applicant is to convince reviewers that the question you're asking is important, that it can be answered, and it's going to best be answered by you. And by you means you and your team. And if your team requires different levels of expertise, that you have them at those appropriate levels.
Mm-hmm. Anything else?
Yeah, I mean, I'd say in 10 years of watching and listening to review, the thing that they look the most at is the approach that you're taking to answer the questions that you want to answer. If they don't like the approach you're taking and you haven't been convincing that your approach is the best approach, you're probably not going to get a good score.
So Chen, I think that your question has been answered at the specific level, but at the more broad level, the type of question you're asking comes up frequently, which is the kind of question of, what is the target I'm supposed to be aiming at? Tell me exactly what it is. And I think the way to approach writing a grant is a little different than that. Think about it as Dave said it very well, your job is to persuade and convince the reviewer toward what you've designed. You are the expert. So instead of looking at what is the external criteria I should aim at, think of it more, what is the way that I can make my argument or my proposal for my specific research so compelling and so convincing they're going to think I should do this. Mm-hmm. Next question.
Thank you very much.
You're welcome.
Patty, this is Ling. I have a question. I've been working with computer scientists, and they're the expertise on using cell phone to trace individuals' mobile behavior and the symptoms of, say, influenza. And I act like a system scientist person, and here's the computer science person. I'd assume we have to get a public health personal medical expertise on our team to submit to NIH. Is that a reasonable assumption?
I think if you're talking about influenza, I think you're not going to be very compelling if you have a computer scientist and yourself who's a geographer. I know that it involves both those fields, but I would for sure bring in somebody who specializes in infectious disease, and particularly influenza, I think, and at the public health level. Right, so you don't want an influenza expert who studies, the virus and its mutations, for example. You want somebody who's at that population level of virus transmission. One place to look is MIDAS, the Modeling Infectious Disease Agent Network. So that's on the NIGMS website, and you should find a whole bunch of resources in terms of publications and people to select from.
What she said.
Thank you, Patty. Other questions? This is Ling again. Another question I think I received from your listserv, a upcoming announcement for a database development, because we have computer scientists in the audience. And that was supposed to solicit mobile phone company and computer scientists to put a database for the expertise. I probably didn't recite it correctly, but does any of you remember that, and could they elaborate on that a little bit further? The formal announcement is not out yet. This is just an alert.
So, Ling, I'm not recalling that.
Uh-oh.
So maybe you saw it somewhere else, or maybe I put it up and I don't remember it, or I'm not remembering it based on your description.
All right.
Sorry.
Okay.
Maybe we can follow up on that one by email, especially if you have more information. So let me just say in short, Ling, I am the person who posts. I don't know everything about all the things I post. I do it for other people. So you might have to contact whoever posted that, whoever was listed as the contact.
Well, thank you. I'll do a follow-up with the program officers identified in the piece of information.
That would be
I think
best.
It's relevant to computer scientists to develop a database.
Okay.
Other questions? I think that probably conclude the Q&A. I really appreciate all the NIH program officers, Dr. Mabry, Dr. Bloss, Dr. Clark, and Dr. Ginexi. I probably don't know whether I pronounce it correctly, Dr. Dietz and Dr. Berries. They prepared the slides. Thank you for very insightful presentation and comments. I think this will have tremendous, profound impact on our later success to NIH proposals. Well, thank you.
It's been our pleasure, and thanks for inviting us.
Well, thank you.